Welcome to the channel. Today's topic of discussion is transcranial magnetic stimulation in schizophrenia. You know, schizophrenia is a complex mental health condition suffered by millions of people worldwide. Both scientists and doctors have sought new ways to treat its debilitating symptoms, and they have found a ray of hope. If this technique, TMS, means in short this is called TMS, means Transcranial Magnetic Stimulation. So if this technique TMS can be enhanced, means it is still in experimental level in some regions. Okay, and what is actually this disease, schizophrenia? Actually, what happens in the patients of schizophrenia, they suffer from hallucinations, both auditory and visuals, then delusions, disorganized thinking, means all are mental health problems. Okay, means mental health is disrupted by the presence of such a disease, and there is abrupt neural activities in the patient's brain. So to some extent, those abrupt neural activities can be regulated by using this technique known as TMS. By using TMS, the pathways can be altered, and that way the patients can be cured to some extent, not fully, to some extent. There are so many advantages. Mainly, this technique is non-invasive in nature, means no surgery is required. Then, targeted therapy. This is second advantage of this technique TMS. Right? Then, few side effects are observed, such as mild headaches. Okay. So side effects are minimum. So these are the advantages. Again, problems are also there, limitations are there. Limitations such as the patients of epilepsy or patients having metal implants, those patients cannot be treated by using this technique TMS. Then multiple sessions are required, means long time is required to treat the patients. So these are the problems associated or the limitations associated with this technique. That means what is the requirement? Requirement is to enhance this technique. Scientists and researchers scientists or researchers, they are exploring ways to combine this TMS technique with other therapies. Again, ongoing research is focused on enhancing the technique itself, TMS technique. So, what is actually this technique, TMS? Magnetic coils are used. Magnetic coils are placed over the skull of the patient. Okay, and magnetic pulses are generated. And you know that in our brain, though the brain in the conventional sense is not a conductor like copper or aluminium, but due to the presence of ions and the other environment, okay, they are able to conduct electricity to some extent. And by using this facility of their conductance, okay, currents are induced by using those magnetic pulses. Magnetic pulses are nothing but electromagnetic waves. So this is the way magnetic pulses are created, means magnetic pulses are generated, and they are sent to our brain, to the patient's brain. And that way, to some extent, the neural activities of the neuron, means activities of the neurons can be regulated. Means reprogramming of the brain becomes possible by using this TMS technique. Reprogramming is required. because the patient's brain is not working properly. That means reprogramming is required. Okay, so specific regions, the regions which are affected by the disease, those regions are the target. And only on those regions this TMS technique is applied, especially in the prefrontal cortex region. This technique is applied, TMS technique. So I have already mentioned there are many advantages, again there are limitations. So research is required, more research is required to get the full potential of TMS technique. Okay, so this was all about today's topic, TMS in schizophrenia. And no doubt there is a ray of hope. Means future looks brighter for the patients of schizophrenia. Maybe in near future we can see more positive results. And already journals, a bulletin, schizophrenia bulletin, they have published that the patients suffering from auditory hallucinations, after several sessions with a TMS technique, okay, they have got positive results. But several sessions were required. They have already published this. That means at present we can say easily that this is in experimental level. Okay. Anyway, so this was all about today's topic, TMS, Transcranial Magnetic Stimulation in schizophrenia. Okay. So this is the end of this video. Thank you. Thank you for watching this video.